Welcome, everybody. Welcome, Patients for Patient Safety Champions and Strategic Partners. We're really glad to have you with us today to talk about what comes next with the Patient Safety Structural Measure. Many of us were involved in developing this measure and getting it into the Medicare Quality Reporting Program. And now we're at the stage where hospitals have to start reporting their attestations of the best practices that are contained in this measure. So we're excited to be a part of that. We're going to talk today about a brief recap of the measure and about a new project that Patients for Patient Safety US started called the Guardians for Patient Safety. And our goal is really just to hit it out of the park, and we've achieved something historic. So let's move forward and really get this implemented in an authentic way. So who are the Guardians? The Guardians is a group of patient safety champions that came together about a year ago to think about what we could do more to really ensure authentic implementation of the best practices in the patient safety structural measure. We worked very quietly for about a year while we made sure that this was, solidly in the Medicare Quality Reporting Program. And our idea was to really put together stories of real experiences that would inspire every hospital to authentically adopt the patient safety best practices that are in the patient safety structural measure. So we're going to walk through that today, but first let's quickly recap what the patient safety structural measure is, for those of you who weren't involved in developing it. So the patient safety structural measure is an attestation measure. It contains 5 statements that hospital leadership has to make annually. The first reporting period opens on April 1. That will be hospitals reporting on whether they had the programs in place that the attestations refer to in 2025. So it's reporting about what they had in place last year. There are 5 domains to the patient safety structural measure. You see them here. I'm not going to read them. And each of the domains has 5 attestations underneath it. So a total of 25 attestations that hospitals need to make. They don't have to say, yes, we have this program in place, but they do have to answer the questions. And the scoring is by domain. So each domain, you can earn 1 point as a hospital if you can say yes to all 5 of the attestations in that domain. So the total number of points you can earn is 5. Once the attestation period opens on April 1, it goes for about 6 weeks. Then CMS will score the answers and start publishing scores by the end of this year. So we are right in time for this first reporting period to roll out. What will the Guardians do? As I mentioned before, our target audience is hospital leadership. And by leadership, I mean C-suite really and governance, although we hope it will cascade down to everyone in a management position in the hospital. And what we have developed are stories that we hope will inspire hospital leadership. And we use a what-if format of contrast stories. So you see in blue here, my hospital did not have this patient safety structural measure best practice in place. What if it had? Would the harm I experienced have been different? That's one way to approach a contrast. Another way is my hospital did have the patient safety structural measure best practice in place. What if it hadn't? Or what if other hospitals did? So the idea is to contrast the measures with being in place or not being in place, and what would be different if all hospitals in this country actually implemented the patient safety structural measure. This is the work group I mentioned that came together kind of quietly. It was brought together by Catherine Biasotti and Dan Corcoran, 2 patient safety champions who started thinking about this and came to PFPS US leadership with a plan. The other members of the work group are Rosie Bartel, a patient safety advocate, who many of you know, and who was involved in the technical expert panel that helped create the patient safety structural measure. I was involved in that technical expert panel as well. And the 5th member of our group is Armando Nahum, who is the COO of Patients for Patient Safety US. Without further ado, that's our team. We will come back after we show you some of our prototype videos and talk a little bit more about this team and how you can be engaged.
Hi, Marty. I hear you have a story about healthcare leadership commitment to patient safety that is relevant to the new CMS patient safety structural measure. Would you share it? We'll then end with a what-if scenario that may inspire other leaders.
I was engaged in a nationwide patient safety learning collaborative called the Partnership for Patients. Supported by CMS, our goal was to engage as many hospitals as we could, and we got almost all the hospitals in the United States engaged to focus on reducing hospital-acquired conditions and 30-day hospital readmissions. And one of them was Parrish Medical Center, which is on the Space Coast in Florida. And a member of the survey team that day was my colleague, Armando Nahum, who had come to patient safety work after the death of his son, Josh Nahum, from a hospital-acquired infection. That's what brought Armando to our work, and it's what brought Armando to Parrish Medical Center that morning. As we walked into the lobby of the hospital, I remember my eye being caught by a very prominent banner hanging from the ceiling that proclaimed their commitment to patient safety. We then met Edwin Lofton, their chief nursing officer, who was also their patient safety lead, and he ushered us into their executive conference room. And as we entered, I saw pictures on the back wall of patients that I recognized had lost their lives to patient safety events, one of whom was Josh Nahum. And I said, Edwin, what is the purpose of those pictures on the wall? And he began explaining to me who they were. And I said, Edwin, I recognize them. I know who they are. And one of them is Josh Nahum. And do you know that you're standing next to his father? And Edwin had not connected those dots until that moment. And it was a moment, one of those moments where time seems to stop. And we all just kind of let that sink in and the feelings that went with it and just the sense of shared connectivity that brought us together at that moment on that day. And as we went through that hospital, we saw the same messaging everywhere, honestly, on the unit walls, in the elevators, very, very prominent for everyone to see, whether you were a patient or a family member or a staff member or a vendor or anyone. And as we talked to Edwin about their patient safety work and their PFAC, he told us that he recruited members for the PFAC from meetings that he would have with patients and family members who had experienced patient safety events at Parrish Medical Center. And that he did that so that they would bring their sense of urgency to the work and consistently remind everyone else that it was important to families, but also to show these families that they were walking the talk at Parrish Medical Center. It wasn't just about signage or about banners or about pictures. It was actually the work being done to learn from their mistakes so that they could keep their community as safe as possible. And I'll never forget that visit, just walking into that conference room and seeing Josh's picture on the wall and then pivoting to the expressions on Armando's face and Edwin's face as they realized who each other were. And just the kind of simple but profoundly beautiful things they did to display their commitment to safety and then walking the talk of doing it. I thought it was beautiful and it was very impressive.
Imagine if the CMS Patient Safety Structural Measure, Domain 1B, inspires every hospital to make its institutional commitment to patient safety transparent to all stakeholders and intentionally incorporate patient experiences into its initiatives and operations.
This first video powerfully shows what it looks like when patient safety is personal for leadership and visibly a core value. When the message comes from the top in a clear, human way, what follows is metrics that carry weight, high reliability practices that take hold, and culture that starts to shift. Let's move to Domain 3, where we see the cost when high reliability practices are not in place.
Welcome, Catherine. We are going to hear the story of your brother's care and the communication gaps. We will then end with a what-if scenario. If the hospital had the new CMS patient safety structural measure in place, what would have been different?
My brother Dave died from sepsis And what makes his death so tragic is not only how sick he became, but how many opportunities there were to intervene, and how profoundly communication failed at every step. On a Sunday evening, Dave was sent home from the ER. When he continued to worsen, his wife called me, and as a clinician, I urged them to return. He was admitted for a rule-out GI bleed. By Tuesday, his lab results appeared in the patient portal. When his wife sent them to me, my heart sank. They showed severe sepsis. At about 9 a.m., I was on speakerphone with Dave and his wife when the hospitalist rounded. He confirmed Dave was septic and in the wrong unit and said they would repeat labs. By noon, those labs showed septic shock. A life-threatening condition, hospitals are trained to detect quickly with alerts and protocols built into electronic records. Tuesday was a critical turning point, and it was lost. There was little to no communication about delays in getting a CT scan to identify the source of infection. Dialysis was postponed due to staffing, even though Dave was in kidney failure and needed it after the CT. No one explained what these delays meant, how serious his condition was, and what the risks were. No physician sat down with Dave or his wife and said plainly how dire the situation had become. That evening, there was no clear handoff among surgeons, nephrologists, and intensivists, even though Dave's wife was at the bedside all day. The only physician communication came late that night around 8:30 p.m. when a surgeon briefly entered after the CT, said no infection source was found, and left abruptly without allowing a single question. Around 10 p.m., dialysis finally began. A nurse reassured Dave's wife, "We got this," and encouraged her to go home and rest. Just after midnight, she received a call saying Dave had coded and had little chance of survival. He died early Wednesday morning, just 34 hours after admission. Dave was a vibrant, healthy 71-year-old. He attended fitness boot camp several mornings a week and was training for his third butt burner, a 10,000-mile motorcycle ride around the lower 48 states in just 10 days.
If the hospital had the high reliability practice of team communication and collaboration among all staff, under the CMS Patient Safety Structural Measure, Domain 3D, there would have been effective handoffs between the general surgeon, the intensivist at the evening change of shift, and the nurses in the loop with a plan of care. And Dave and his wife would have received honest, ongoing communication about delays, findings, and the seriousness of his condition. Thank you for sharing your story today.
The cost when high reliability practices are not in place. In this case, my brother. Domain 3 asks hospitals to go beyond policy, good intentions, or rhetoric and embed at least 4 high reliability practices into daily operations: safety huddles, leadership rounding, data infrastructure, evidence-based technology, proven improvement methods, team training, and human factors engineering. It's where the commitment we saw from leadership in Domain 1 becomes hardwired into how the hospital actually runs. Our final video takes us to Domain 5, where we see what happens when organizations learn from patient experiences and turn those lessons into real, lasting change. This is where leadership and patient engagement come together as a partnership.
Hello, Rosie and Laura. Welcome. You've co-produced a comprehensive patient-provider partnership at Amplify Health by Bellin in Green Bay, Wisconsin, one that could serve as a model for hospitals nationwide. This is exactly what CMS's Patient Safety Structural Measure calls for under Domain 5, Attestation D, meaningful inclusion of patient and caregiver input on safety events. We'd love to hear all about it, how your partnership came together, and what it looks like in practice.
Rosie has been with us since 2010 and has influenced us in many different ways on different committees. Her insight and input has really helped us in our design features of some of our facilities, our quality committees, helping us pay more attention to what really matters from the patient perspective when it comes to patient safety. We'll talk about patient safety events or harm events that may have occurred in the organization, and having insight through the patient lens helps ground us as to the why. Why does it matter? Hearing the patient perspective so that we can improve together collaboratively.
I did age-friendly structural measures and the patient safety structural measures. I was pushy about it. I kept talking about the patient safety structural measures and the National Action Plan and how important it was. And you said that one of the words is that it's a partnership. I have my experiences as a patient, and then there's the experiences that the healthcare providers have. And those two have to work together, and I can't do their job and they can't do my job, but we can do the job together. And that's how I got started in this, being invited to the table to look at what went wrong and how can we make it better for other people moving forward. And, like I say all the time, my story is not a sad story, but it's a story of helping create change. And I don't tell my story because it's a sad story. I tell my story because I want to create change.
That ability to cascade the information down to those who work right on the front line and explain the why we watch is, our patient safety culture survey. How do our staff feel about our commitment to patient safety and the culture of safety? We continue to see that increase, and it comes because we are collaborative partners with our patients and families, and we want all of us to work together to produce those better outcomes.
I feel like I am welcome at any table here. I was asked to the table in the beginning, but now I volunteer multiple times because I'm like, I want to be part of that. I want to be the patient voice. As long as I be alive, I want to be the patient voice at Amplify Health by Bellman.
Now, imagine this. What if every hospital in America engaged patients the way Amplify Health has, genuinely inviting them to the table and valuing their input in patient safety work? And what if patient advisors across the nation engage in helping their hospitals implement the patient safety structural measure, not just on paper, but at every level of the organization? Just think about how much safer our healthcare system could be.
Domain 5 is about hospitals actively including patients and caregiver lived experience in patient safety work through patient safety event reporting, learning from complaints, and using patient safety lived experience data to drive change. That's exactly why we built what we are about to show you. Because if we are asking hospitals to include patients and caregivers, that takes leadership and courage. We need to celebrate how they do that. That is why we are bringing you a very exciting announcement.
So our great announcement for today is that we have built a website to reflect all of this work. And there you have it. This website is actually in the domain of Patients for Patient Safety US. There's cross-link because this project sits on the Patients for Patient Safety US. And here it gives you, it's a very simple website, easy to navigate. It has a little bit about us and then the attestation stories. We've also have included a button that you can go to where it has examples of Contra stories, which are the 3 videos that you've seen. And then it will take you into, if you scroll down, obviously, it takes you into a Guardian of Patient Safety Structural Measure agreement form. We must have an agreement from you in order for you to tell us the story. So where's the story being placed? The story, once you fill out this particular simple agreement form and you click submit agreement, a new form pops up to actually write down your story. And the story comes to us for review, and then we'll be in touch with you after that. We're super, super excited about this and building these stories, and of course, highlighting it at CMS Quality Conference in March. It's just a great accomplishment. Marty?
As Armando just mentioned, we have an opportunity to launch these videos at the big CMS conference that's happening in about 2 weeks. It's called Quality Conference. You can attend it virtually at no cost. The videos are going to play during breaks as people go from session to session in the public areas of the conference. So we're pretty excited about that. We wanted to share the videos with you first before we launched them at the CMS Quality Conference. The ways in which you can be involved is by helping us build out our library of stories. We've shown you 3 prototypes. What would be fantastic is we could get a story, at least one story, for each attestation in the patient safety structural measure sometime this year. PFPS US will use these stories in our advocacy. We will distribute them widely so other organizations can use them. We hope that hospitals will use them. We'll be tracking that. Our goal really is to change the standard of care and make these best practices the standard of care for every hospital in America. We'd also invite you to become more involved in the work group that I mentioned earlier. We're a small work group. There are roles for other people in helping us recruit stories and look at stories and develop those stories. So go to gpssm.com and join us if you can. We'd also invite you to join PFPS US as a patient safety champion. That's where we recruit our work groups from. So we're excited about going forward with this, changing the standard of care as quickly as we can. And we invite you to join us as we go further. Have a good day, everybody.